Thank you so much, Steph. The city asking apartment and condo buildings to put in some enforcement when it comes to masks in common spaces, put out some policies. And that's just one of the issues we are addressing right now with Mayor John Tory, who joins us live via Skype for his weekly check-in. Good morning to you, Mayor.
Hey, Mel.
Oh, so we just had our call-in segment here where people were chiming in about those common spaces in the apartments, in the condos, and it was a resounding yes. Yes, we need this, where some apartment buildings and condo companies have already put something into place. Some have not. But what does it mean when it comes to enforcement? Can the city do anything about it?
Well, this is one of the difficulties of having a law versus them having a policy within their own buildings. Let's start with condos. The condo people you heard from, they are the owners of their own building, and they are the people that own the corporation that runs the building. And so they're perfectly well positioned to go to their own board of directors and say, in our building, we want a policy that says you wear a mask in the common areas. In my building, I live in a condo, the board has passed such a policy, and the signs are up saying this is a area where you wear a face covering in the elevators and the lobbies and so on. It's a bit more complicated for residential rental buildings. And so that is why I've asked the industry, the Greater Toronto Apartment Association that represents the owners, to take a hand in encouraging their members, which they have said they will do and they're doing, to have such policies apply in the elevators, laundry rooms, lobbies of residential rental apartment buildings. Our ability to both legislate that and, as you pointed, to enforce it with the hundreds and hundreds of buildings is limited in both cases, both the legislative authority and the enforcement. And so it would be way better if the residents, again, just spoke to the landlord and said, look, we want this policy. This is for each other's health and safety. So let's get on with it. It's not that complicated.
And I know public health has made it as easy as they can, downloading different posters and different protocol that can be used through management. I want to get a bit of a pulse check from you on how things have been going within the City of Toronto with public indoor spaces, TTC, Metrolinx, all making masks mandatory. I've personally seen a lot of interesting confrontations with people refusing to wear masks and getting into some verbal arguments with people. What have you been hearing from staff, enforcement, TTC, anyone on feedback on what it's been like with the response from the public?
Well, TTC, we're using both technology and eyeballs to actually measure, and we have about a 90% compliance. And there are instances, for example, where it was brought to my attention on the media that we had on the King streetcar, people eyeballed and said there was only 25 or 30% compliance. So we sent some people over there, and their job is to go and to educate and to say to people, look, it is the law, and please, for the sake of the health of your fellow passengers, please put on a face covering. And so I think we're finding pretty good cooperation. Now, you say there are these incidents. I've seen a couple through the media. I think they're few and far between. I think most people, I'm really actually very heartened, compared to the sort of polarized, divided, angry situation you see in the United States where there just seems to be one of these going on every hour. Here, there have been limited numbers of confrontations. I think that represents a tiny minority of people, because I think most people, including me, look, if you said to me, do I like wearing these masks compared to normal when I don't have to? Not particularly. But I also understand, first of all, I have to set an example, but more importantly, I have to protect the health of others in case I'm carrying something, and I hope they do the same for me. So I think most people have adopted that attitude. They know that if they do it, we will be through this a lot faster, and we will have a much less chance of there being some kind of a spike up in the numbers of people with COVID-19.
Absolutely. Last thing we want to do is go backward. We want to move forward. We would like to move on to stage 3. How are we looking when it comes to the numbers? We had Dr. Eileen Davila joining us yesterday to break down sort of the medical background, but how is the city prepping right now as we look to stage 3?
Well, we are preparing, and because we know it's going to come sooner or later, and we very much have our fingers crossed it will come. So we're, for example, inspecting all the playgrounds. We are preparing extensive guidelines that have been put together for restaurants that are going to have indoor dining, so everybody knows what the rules are, and we won't waste any time getting going once the green light is on. But, I think you heard Dr. Davila say to you, I'm sure as she did with us yesterday, privately and publicly, that, they're watching the numbers very carefully, and they're watching us as well. Places like BC and Alberta and Montreal and even the U.S. where, when they've reopened the bars and restaurants, for example, this has caused, they think, some uptick in the numbers. And that's the kind of thing we want to avoid. So we're taking a cautious, measured approach based exclusively on medical advice from Dr. Davila and her officials. They're a great, competent, objective team. And we're making our decisions based on science and not on political science. And I think that's how people in Toronto want it. And by the way, the province is doing the same thing. And so I think people should be heartened by that, because we're putting their health first and the ultimate health of the economy. Because you know what? The economy will not be helped by opening up for 3 or 4 weeks and then finding it's some kind of a real disaster and having to close down again. Nobody wants that. That would be more damaging than what we have going on today. So, but I've got my fingers crossed that we're making, progress, steady progress on the numbers, and we've got to keep it going that way.
Yeah, I've got the fingers and the toes crossed, Mayor. You can't see that. They're under the news desk here.
Okay.
But when we look to the money, obviously we put out the figure being put out about $1.35 million or billion-dollar deficit with the city. We know the province, we know the feds are giving money to the provinces, divvying it out. Have you had any further word on how that's going to be divvied out for the city of Toronto?
Not really. Again, fingers are crossed. We've got some word today about, but it's something I knew, which is the quantum across the country of money being given by the federal government to transit. And I want to say thank you to them for that. And the province is stepping up too, and did step up in a big way. So now what they have to do is take inside the province of Ontario the money and divide it up among all the different municipalities. So it's not just the ones in the GTA that we know better because we live here, and we've been working well together on the transit, and we have the bigger transit systems in the GTA. But there are 400 and some odd cities and towns across Ontario, all of which have their needs. So they're making that decision now. I'm optimistic that Premier Ford and his ministers understand that the city of Toronto, being a city of 3 million people and 20% of the economy, by far the biggest transit system with 1.8 million riders a day normally, that we have problems that are bigger, and that we will get what would be a fair share relative to the size of the city and the size of the transit system and so on. But we haven't got any firm word on that as yet. We're expecting it soon.
Okay, great. As we also are hoping for that excitement of stage 3, we will do this together, Mayor.
Okay, we'll keep those fingers crossed. Absolutely. I can see your fingers are crossed, yes. You get Frankie and Dean and everybody to do that too, okay?
Yeah, she's on the side doing that. They're doing this.
Everybody's got to have their fingers crossed, okay.
There we go.
Tell them to cut back on the coffee a little bit. I noticed a little
wait, he said cut back on the coffee.
What makes you think we have too much coffee, Mayor Tory?
Look at,
What makes
look
you
at the
think
energy
this?
level over there.
I don't know what you're
I'm a little worried
talking
about that. I heard Frankie mention cannabis earlier too. I don't know. Look at, I rest my case. Thank you very much.
I'm just going to go climb the walls. I'll be right back.
It's a professional program over here, Mayor.
We've lost control.
Thanks, Mayor. Have a great week.
Bye. You too.